The only people keeping markets in healthcare from being competitive is the United States government, the lawmakers who get lobbyist dollars, right? Because that's all those guys care about. And then it's the health system is in the banks. And so you've just got this massive problem. Again, though, all of this can be squared up.
All right.
So we do need some relief from lawmakers, and we do need some physicians to do a couple things. But other than that, I think we can beat the pants off these health systems. I don't think they're as powerful as the independent physicians are.
And so tell me about the PBMs, because that's another fun line of business that United Healthcare is on. How do they make money?
They make money the same way. Look, the number one way they make money is, one, in Medicare, they don't have to negotiate. So you're a pharmaceutical company, you're Eli Lilly in Indiana, in the great state of Indiana, right? One of my favorite states. And you say, I'm going to release this drug and I'm going to charge $1 for this drug. The PBM says, no, we're not going to do that. We'll take your dollar, you'll sell it to us for $1. And we're going to charge $500 for it. And we're going to get it. And there's no one that can tell them different. The federal government, again, CMS, made a deal to do this and just write a blank check. Again, when you look at the number of employees going back and forth between carriers and the bureaucracy in Washington, D.C., not far from where you are, like, this is just what happens. They just trade jobs. If you're really good at healthcare policy, you're going to end up at an insurer. And they're going to pay you a lot of money that you'd never thought, I'm going to make $500,000 in a year. Guess what? You are now. You just handed those guys $1 billion. It's a big problem.
And so the PBM, so to just level set, for example, Ozempic and Mounjaro, Eli Lilly makes Mounjaro. They sell it for about $300 for a month worth. And then the PBMs sell it for $1,200, $1,300 a month.
That's right.
And that they pocket that. And because of the ACA, BM's a different bucket. So it's not beholden to the 15% profit rule. And so they can make as much profit as they want.
That's
and
right.
if that wasn't enough greed, then United Healthcare is the biggest employer of physicians in the country.
That's right.
And what do they do?
Let me just say something really important. MLR, right? You've got small group that it applies to and large group. Small group, 15%, large group, 20%. Or maybe it's vice versa, but it's one of those. And so you've got some differences. On some plans, it's 20%, some plans 15%. Now, MLR does not apply, the minimum loss ratio does not apply to Medicare, Medicaid, or self-funding. So the good news is MLR does apply to about 80 million people in the country. It doesn't apply to self-funding, which is about 105 million people. It doesn't apply to Medicare and Medicaid. Now, Medicare and Medicaid have different standards that might look similar on a policy based on MLR, but the minimum loss ratio only applies to those guys. The good news is that they won by doing that. If I was them, I would love it. MLR. Hey, I could just raise the price from $1 to $5 and I'm getting 15 or 20% and I get more. It's pretty great.
Yeah.
If you're them, this is the greatest deal. I wake up every day with a big grin on my face going, we're just taking money like it's candy.
And they're taking it from premiums on the insurance policies because
That's right.
they increase the health insurance. I'm an employer also, right? So they increase our premiums by 10%.
Yeah, easy.
And they blame it on COVID. They blame it on, that's the way it is, the economy, whatever you want to blame it on, who to blame it on.
Yeah.
Yet the reimbursement to physicians
is lower.
Pathetically low.
Yes, because it's
how can a large commercial policy reimburse less than New York State Medicaid for 913?
Because it's doing that for you, the independent, but not for the health system.
Yeah, I've seen that because now I see them on the different doctors.
Yeah.
And my wife went to her OB that delivered both of our kids, was in practice. He did his thing and now he's retired. So now he's taken over by the system.
That's right.
A routine woman's check was like $400 paid by the same insurance carrier that we get.
Yeah.
We use.
No, it's not. But again, you really need market forces to make a change, right? Like everybody says when we used to have stock trading, it used to cost $8 a trade and now it's free. Guess what? The federal government and their cronies didn't step in and say, bro, it's $8. We're mandating that all trades are $8. They said, okay, there's Schwab, There's Robinhood. There's this guy and that guy, right? And they all came in and said, well, we're going to dismantle this whole system. And the free market let it work. And so you went from when I was coming up, 97, 98, living in the city, trades were $8 to $10. And today they're free. Like Scott Trade made it free. Schwab made it free. That's what we need in healthcare.